went to Alexandria Hospital as the first midwife to work in that hospital and to work in that public health clinic. Where did all those unregistered women come from? Where did those poor women come from? Well, they were working within the town. The setup for them was, for their care, was to come at 8 in the morning to the clinic, sit all day in the clinic, wait until a physician was able to see them, and if the physician got called out to a delivery, they'd say, "We're sorry, the physician had to leave, please make another appointment." Women just said, forget it, and they would show up at the ER to deliver their babies, and they wouldn't get health care. Our team was called in to try to fix this. A number of things that I instituted were for women to come in, they'd have a morning appointment or an afternoon appointment, and they knew they'd get seen. Voila! Women came back for their appointments. The nurses taught them how to weigh themselves, how to check their own urine, so had them actively involved. It was a really very high-risk population, and we had very good outcomes. Within a year of having me on ground, I was seeing about 80% of the women. Our NICU admission rate dropped to below 20%.
Appreciating some of the ramifications of trauma and life events and how we can help people navigate to a healthier, lifestyle or life. And it's not just about the physical health, but also the mental health. I call it midwifing them through some of those traumas. We can facilitate them navigating this birth experience so that it's a positive one for them. Enjoy their babies and not have to reflect on that negative element that is so important for us to be able to create that, even though it goes against sometimes, the natural process for us. I will do everything and anything to facilitate, not using any anesthesia, but there are times when that needs to happen. I'm glad that we have that tool available. We have to be flexible. We have to accommodate to really maintain the integrity of the individual.
Although we do care for women and do value our role in caring for women, sometimes other things get left behind, like our families. So I do want to always encourage students to have the proper perspective and know that their families and their care of themselves is certainly a priority in their lives. That to me would be number one. Make sure this is your passion and make sure this is your calling. Once you are in the role of a midwife, just always be moving forward to thinking about what you can do to move the profession forward. Don't get stagnant in your role as a midwifery provider to the point where you're not reaching out to see what else you can do as a provider that moves beyond your role. And that also involves moving beyond your comfort zone a lot of times.
Finding out how to really assert yourself, assert your practice, argue on behalf of your patients. That was a whole new world for me, academic medicine, and it just was a similar thing where you had to prove yourself over and over and over and over. I was the first midwife to practice in Rochester, pretty much in the whole upstate New York. I guess in the early days I was pretty self-confident. I really did have a lot of self-confidence. In fact, I think I still do have a fair amount of self-confidence. Sometimes you don't know what you don't know. I was young. I was 29 years old. I just blended in with the residents. So in order to really find out what was going on, I knew that they had morning sign-out rounds and evening sign-out rounds, and I would go to those rounds at least every evening. If I had a patient that got admitted in preterm labor, then I would say, "I'm following her along with you." And they were like, "Okay, fine." I became one of the team that way very quickly. The residents easily accepted me, and the attendings accepted me. They didn't know what else to do. The chairman had me as his partner in private practice, so I had a great deal of prestige from that.
I sort of consider myself as a first step catalyst, a first step for many, many, many women to really reach down to know that, that they matter, and that I care. The opportunity in a very short time frame to build that trust. I have good listening skills, and I'll encourage somebody, you don't have to jump in the river. You can just put your, just dip your toe in. And all the women that I've taken care of, probably 2 or 3 dozen, these were women who didn't have a high school diploma, who are now professionals, nurses, some midwives, just over a couple of years, seeing them for their annual exam. How are things going? Tell me what's happening. And just saying to them, you matter. You matter. I care.
Whatever kindness has passed along with me over the years, I give it back 10 times, many times. Because if you're treated kindly, you're kind to others. Sometimes it's appalling to see how people are not kind to others, especially the young ones. I've had so many breaks, in my lifetime. That is wonderful. My midwifery tutor, when I was at UC in Jamaica, she was very good. I said, how could she taught midwifery like this? She taught us without a textbook. So I have a tendency to do things like that, because you must know your work. You don't have to be reading a lot of impromptu as far as I'm concerned. If you know it, you speak it.